who's in honor of the transition to democracy, all were trained. Well, let's go to Zambia. The defense attaché there wants us to work with them. Nelson, we're going to Nigeria. Roger, sir. The Honorable Minister of State for Defense, Roland Rizajafo, and Ambassador John Campbell gave us our marching orders on that trip, and over the next 7 years, we forged a partnership and trust that might normally have taken decades. Our program experienced incredible growth in saving lives through treatment and prevention, building a research platform, developing human and physical infrastructure, and so much more. We didn't do this on our own. There are so many people, military, civilian, Nigerians, Americans, who contributed their time, their effort, their support, and in some cases, sadly, their lives. I apologize to all of you. There's simply too many to name in such a limited time. I'll share one striking reflection. Early 2011, then Deputy Secretary of State Jack Lew, on a tour of PEPFAR activities in Nigeria, visited one of our military sites. After Major General Njoku and Umar had led him through an extensive review, Deputy Secretary Lew pulled me aside and said, I often hear the term host nation ownership, but this is the first time I've seen it and felt it. I couldn't ask for more. Congratulations on 20 years of partnership and impact. I wish you continued success in advancing force readiness and public health.
I got involved with this program right from its inception 20 years ago as clinical research officer. I've since then grown to be the Director of Defense Reference Lab and now clinical research advisor of the program. One of the most striking achievements that I've witnessed throughout my period of being in this program is the introduction of the Nigerian Military Medical Research Training Program. This will help to build future researchers for the Nigerian military and the country at large. Congratulations to the partnership after 20 awesome years. I wish you all a very happy celebration with our two countries joined together as one.
My name is Dr. Tiffany Ham, and in 2004, I led the HJF team who helped establish the partnership around PEPFAR between the Nigerian Ministry of Defense and the Walter Reed Army Institute of Research. I keenly remember my first trip to Nigeria and how impressed I was by the enthusiasm and passion the Nigerian Ministry of Defense had for addressing HIV among its ranks and the civilian population surrounding its bases. Recently, I had the opportunity to re-engage the Nigeria team under a new program to conduct surveillance on antimicrobial resistance. This has allowed me to reconnect with old friends, meet new collaborators, and witness how far this program and partnership has come over the past 20 years.
I was privileged to work on the NMOD DOD program as a site team leader in Kaduna. From 2005 to 2007, I was the first site team leader, and I later on came to head the program from 2008 to 2014 as the chairman EPIC. It was then known as Emergency Plan Implementation Committee. Looking back over the years, I have been very pleased since I'm here in Abuja, and I've seen the progress made over the years, and I've taken part in the siting leader meetings and even steering committee meetings, and I've seen that we have made a lot of stride. And one thing that comes to mind is this is a partnership that worked and is still working. We have been able to improve on our clinical competence through the health system strengthening that this program has been able to provide, and that is something which is quite heartwarming. Each time I go to the DRL, I'm so happy that we have put up a lab that is a thing to be proud of for the armed forces. And it's also something that is going to offer us opportunity for research, which is now where I think we have a challenge. We have been trying to improve our research capability, and I believe we have the means to do that. 20 years on, I wish to congratulate the NMOD USDOD program for impact on our force readiness and also on the research capability that we are going to put in place and the progress that we have made over the years.
Now, my name is Major General A.E. Life Ajemba, retired. I'm a chief consultant physician and cardiologist. I was appointed as chairman MOD EPIC on 20th August 2014 as the last chairman MOD EPIC, and also became the first Director General MOD HIP. Yes, when I took over as chairman MOD EPIC, I discovered that we have been on emergency plan for 10 years, and we needed to expand the scope and mandate of the organization. So I had to get permission from the Minister of Defense and U.S. Ambassador to change the mandate. So we changed our name from MOD EPIC to MOD HIP, Mutual Defense and Implementation Program. That change in name and status has affected a lot of things. The title of the headship changed from chairman to director general, and then we were able to incorporate other things that we could do that we were not doing before. Aside HIV treatment and research, we now have directorate for non-communicable disease and also directorate for other communicable diseases like Ebola, COVID, Lassa fever, and so on. We also started the first Ebola vaccine trial with GSK Pharma, which was eventually concluded and was successful.
My name is Robbie Nelson. I first came to Nigeria in March 2010 and completed my duties there in July 2019, working with the Nigerian Ministry of Defense, the Ministry of Health, academic partners, among others. It was a wonderful opportunity, and the amount of impact that we made was absolutely amazing. And I was so fortunate to be a part of that growth, that experience, and the impact that we've made, and the ongoing success that we share together in developing vaccines, therapeutics for folks with HIV and other infectious diseases. I want to say a special congratulations to your 20 years of service and impact. It is truly laudable, and I look forward to the next 20 years of your success in Nigeria with the Walter Reed Army Institute of Research.
The program has moved from band to band. A lot of things have happened. I can confidently say that it's one of the military models that help to reduce the infectious diseases, not only within Nigeria, but also the Western sub-region. The program has been involved in training a lot of capacity building of our personnel, both within and outside Nigeria. It has also been involved in a lot of adherence counseling sessions, which has helped one way or the other to reduce the prevalence of HIV. I must also say that this program has been able to cater for 80% civilians and 20% military personnel, obviously meaning that it has impacted so much on the national health response to HIV. Aside that, it's been involved in a lot of research activities within and outside the country, both local research and multi-country research activities. I must say that the program has done very well within the last 20 years of its inception. It has also been able to impact so much on the military, bearing in mind that the health status of the military personnel also determines their combat readiness. In this situation, it has helped Nigeria as a country to be able to handle diseases that would have impacted negatively on the health status of our community. And this has also helped indirectly in improving our combat readiness. I must say that I'm very, very pleased with the program, and I'm happy to be part of this program since its inception.
Hello, my name is Dr. Laura Chittenden. I served as the Royal Nigeria Deputy Country Director from 2018 to 2019 and the Country Director from 2019 to 2022. Throughout that time, we worked shoulder to shoulder with ModHIP. Together, we ensured the best possible care and treatment for our supported clients, contributed to the body of global health knowledge, and impacted the force readiness of U.S. and Nigerian warfighters. During the time I was in Nigeria, we continued to build relationships within the Ministry of Health, including with NASCOP and NCDC, and with external collaborators such as ACEGID. We continued to maintain excellence in patient care, including increased viral coverage and suppression. And then finally, we served as a vanguard for laboratory excellence, maintaining A2LA accreditation. But as the partnership grew and strengthened, we maintained other milestones. First, during the COVID-19 pandemic in Nigeria, we were a critical component to the response. We established a military emergency operations center, and through the EOC, we were able to include the Defense Reference Laboratory and the National COVID-2 Testing Network. We were exemplars in the practices of infection prevention and control, and we maintain excellent patient tracking methods to ensure a steady supply chain and to monitor the spread of the disease. Secondly, we increased our research activities during this period to include Lassa fever and Mpox and increase the number of publications during that time. And finally, and most importantly, we were able to formalize the partnership with a binding agreement, which was overseen by steering committee chairs of the U.S. Ambassador to Nigeria and the Minister of Defense. These are only examples of my time in Nigeria, but these built on many, many years before me and the successes of my predecessors. And I am sure that there'll be more successes in the years to come.
On the assumption of first peace, we settled down to work with my colleagues, did analysis of the program and identify challenges. Those challenges we were able to tackle immediately. First was to strengthen the collaboration between the two program heads. On settling down and taking care of that, we went into strengthening the collaboration with sister agencies, and that we were able to fulfill. That gave us a big advantage to be able to deliver on our core mandate of reducing the impact of HIV among the military and the communities around the barracks. After taking care of this, we settled down for emerging and re-emerging infectious diseases. The one that came readily to mind and challenged all the whole world was the COVID-19. During this period, we were able to establish testing centers, collection centers, containment centers, and we did a lot of training to build capacity of our staff to be able to handle the challenges. On this, we were able to deliver on the laboratory, we were able to complete the TB modular lab, as well as establish a properly built laboratory at 82G Hospital in Enugu. We were able to start the permanent site of Ministry of Defense Health implementation program, since we have been operating from a rented apartment, and then we go ahead to send the program a lot of resources. We were able to establish a program, the internship program for training of intern laboratory scientists. This went ahead to help us to add to the strength of staff we needed for the execution of this program. Added to during my program was the getting a memorandum of understanding between the two programs, because during this time the program was operating. I want to thank everybody that is participating in this program, 20th anniversary of this program, and wish the program staff, the program leadership the best. I thank the Honorable Minister, I thank the Ambassador, I thank the two leaderships of our program, joint program, and I wish you the best. Thank you very much. I say bravo to all.
Thank you very much. Thank you very much. Please put your hands together for yourselves very warmly. That was a long break coming from the video on the screen. Thank you very much. Thank you. Now we're going to move into another very critical and important part of this event this afternoon. I'm about to bring someone on stage who is very important, and that's the keynote speaker for this event today. The keynote speaker is none other but Brigadier General Nuruddin Ayola Hussein, retired, and he will be speaking. So I think there's a change of plans, and then we'll bring the keynote speaker just immediately after this activity, please. I beg your pardon. Thank you.
Thank you so much, Naomi. Your Excellencies, distinguished senior officers, invited guests, ladies and gentlemen, I wish to announce a slight change on our program. The special guest of honor is billed to have an engagement elsewhere. On that note, we shall quickly take the presentation of souvenir before the special guest of honor departs this venue. May I, on this note, respectfully invite the Director General, Ministry of Defense Health Implementation Program, who will be assisted by the Country Director, Walter Reed Army Institute of Research Africa, to please do the presentation of souvenirs to our distinguished guests. First on my list is the special guest of honor, the Honorable Minister of State for Defense, His Excellency Dr. Bello Mohammed Matawali, Member of the Order of Niger. May I also respectfully invite the United States Ambassador to Nigeria, His Excellency Ambassador Richard Mills, Jr. May I also invite the Chief of Defense Staff, General C.G. Musa, Officer of the Order of the Federal Republic. I also have the honor of inviting the Commandant General, United States Army Medical Research and Development Command, Major General Pauli Lodi. Also is the Commander, Walter Reed Army Institute of Research, Colonel Brianna Pareta. May I also invite the Director General, NCDC, Dr. Babajide Idris. And to conclude this presentation, may I have the honor to invite our keynote speaker for today, Brigadier General N.A.A. Hussein, retired. That concludes the presentation of souvenirs. Your Excellencies, very senior officers, may I respectfully request that we rise for the national anthem before the Honorable Minister departs this venue. The national anthem, please. Thank you so much. May I crave our indulgence to please remain seated. The program shall continue in no distant time. Thank you.
Stepping out, please don't step very fast. Don't go very far. We just might be continuing just almost immediately. So please, as you're stepping out, don't go very far. We're going to start this event almost immediately. Please don't go very far. We will have to continue with this immediately. Thank you.
right, distinguished ladies and Naomi. Distinguished ladies and gentlemen, if you are outside, please can you come inside? Yeah, I want to. Please, if you are outside, can you come inside? For those outside, can you go inside? We want to start. Please, can we go inside? Please, can we go inside? We want to start.
Thank you very much, ladies and gentlemen. For those of us who are outside, if you can hear the sound of my voice, please, it's time for us to come back inside. The second phase of this activity is about to commence. Please kindly come back inside. Let's come back. We're about to start the event. Please, wherever you are, if you can hear the sound of my voice, let's kindly settle in, settle down. We're about to continue with this event very quickly. Thank you.
Please, if you are outside, can you come inside? If you are outside, please, I'll start calling names. So. You know, I know. The DG, sir. I go start with that. Sir, we're waiting for you to start. The DG, sir. Once the DG comes, we'll start. Please, can we get seated? Please, be happy seated. We'll do pictures. We have plenty of time to take photographs. Please, can everybody sit down? Can everybody sit down? Yes. Colonel Aheni, we are waiting for you, sir. Thank you very much. Air Commodore Ekpe, we are waiting. Air Vice Marshal Ekpe, we are waiting for you, sir. I say Air Vice Marshal now. AVM. Please, let's sit down so that we can start. Please, let's sit down. The DG is here. Okay. So I'll start naming your staff that are not sitting down. The country director is here. I'll start naming your staff that are not sitting down. Susan, what are you still doing? Please sit down. Good. Ernest, Kainde, please can you sit down? Ernest, Kainde, can you hear me? Aminu, please sit down. Please, can we sit down? We want to start now. Please, let's sit down. Please, let's sit down. Yeah, please, let's sit down.
Thank you very much. Please, for those of us who are sitting, the seats at the front are empty. We just might want to take some steps forward a little so we can fill up the empty spaces in front. I'm working based on instructions. Please, those of us behind you, you'd want to step forward, and those are just take 2 steps forward or 1 step forward, as the case may be, please. Just a step or 2 forward, 1 step or 2 steps forward. 1 step or 2 steps forward. 1 step or 2 steps forward. Please, let's do that very quickly. Thank you. Thank you very much. Thank you. Just take 1 step or take 2 steps forward if you can. Thank you very much. Thank you very much. Thank you very much. This applies to those people at the back. As people are moving forward, please join them as well. Thank you. Let's take some steps forward very quickly. Let's take some steps forward. We want to fill up the spaces in front, and then we can continue very quickly. We're still seeing some empty spaces in front. Please come forward. Just step forward very quickly before we continue. Thank you.
Please, the Naomi is upgrading you to business class. Please move forward.
Don't be afraid of the white chairs. Just
please.
come forward. Take some steps forward
You're
and
on the
sit
brown.
down.
Please come to the white so that you are upgraded to the business class. And you have enjoyed that.
We want to make sure the white chairs here are filled before we continue. Please step forward. We don't want empty spaces. They don't look good.
Group captain, call, you are upgraded. Dr. Stefan, you are upgraded. You see? Dr. Mohamed Turaki, you are upgraded, sir.
Saw you in the club.
All right.
You were dancing with somebody. So close, so tight. You were killing so slowly. My friends are telling me what you doing can drive a man so crazy. I try to live my life. It's been 6 months since you left me, so why, oh why, oh why? Still thinking about you, baby.
Thank you. Thank you. Thank you very much. Thank you. I mean, if I were sitting at the back and someone says step forward, I would take the opportunity and just upgrade myself almost immediately. Don't be so afraid of upgrading yourself. Thank you. All right, ladies and gentlemen, at this point, we're about to start the second part of the event. Sorry, we had to cut at some point, but at this point, we have our guest speaker already here. The keynote speaker is here already. We'll be bringing him on stage at this time and get to introduce him to you appropriately. Distinguished guests, ladies and gentlemen, please, if your hands belong to you and they are not busy, I want you to put them together as we receive on stage our keynote speaker, Brigadier General Nuruddin Ayola Hussein, retired. Keep clapping as he comes on stage. Keep clapping for our guest speaker as he comes forward. Keep clapping, you can make it better. He's very important. Our keynote speaker is stepping forward. Thank you very much. Just very quick introduction of whom our keynote speaker is. Brigadier General Nuruddin Ayola Hussein, retired. He attended institutions including the Nigerian Military School Zaria, the University of Ilorin, Nigeria. Professional qualifications include MBBS, MPH, FWACP, FMCPH, Diploma in Disaster and Mass Casualty Incidents Management, and his areas of specialization include public health emergencies, epidemiology, health services management, and his key research interests are infectious diseases and reproductive health. For his military career, he served as medical officer at the ECOWAS peacekeeping mission in Liberia between 1994 and 1996. He also served as Commander 82 Division, Medical Services and Hospital between February 2009 and September 2011. He also served as Commander Nigeria Level 2 Hospital, United Nations mission in Darfur, October 2012 to May 2013. He also served as coordinator of the Nigeria Armed Forces Program on AIDS Control between August 2013 and January 2015. He also served as Director General of the Ministry of Defense Health Implementation Program between August 2015 and January 2019. And he also holds lots of awards, including the PEPFAR Heroes Awards for 2019. His research publications and academic inputs published over 30 scientific papers in peer-reviewed journals, delivered lectures in several local and international conferences. Yes, that's a very good place to clap. And he has also served as examiner at the West African College of Physicians and National Postgraduate Medical College of Nigeria. Currently, he serves as the Dean at the Faculty of Clinical Sciences, Bayes University, Abuja. Distinguished guests, ladies and gentlemen, please give a round of applause for Brigadier General Nuruddin Ayola Hussein, retired, our keynote speaker. Thank you very much.
The special guest of honor permit me to go through part of the protocol. In spite of the fact they had left, I still want to recognize their presence here. The Honorable Minister of State for Defense, the U.S. Ambassador, the Chief of Defense Staff, and our mother, the President Defense Police Officers' Welfare Association, and very distinguished members here present. Please allow existing protocol. With your kind permission, I will take this special presentation. I was given 15 minutes, and I felt for a program that is of 20 years duration, you should have a minimum of 20 minutes. That means at least 1 minute per year. So I believe this August gathering will give me that opportunity. Let me start by telling us that the HIV/AIDS, my topic of my discussion this morning is looking at advancing force readiness and public health, 20 years of sustainable military-to-military partnership. And in doing that, we have heard in our previous discussion, conversation this morning, that everything revolving this program emanated from the HIV scourge within the country, especially the way it ravaged the military. So we must start by looking at the background here to say that the first reported case of AIDS in Nigeria, just for us as a memory, along memory lane, involved a 13-year-old girl. And that was in 1986. So you can imagine that age of a child having it. But beyond that, the military also had her own brunt. And what were the propellants of HIV/AIDS in the military? The increased insecurity leading to more frequent deployment of our troops. Then troops' participation in the ECOMOG operations. Remember, during the days of ECOMOG, at a point in time in Liberia, there were 2 countries that were brought in that had a higher burden of HIV/AIDS. And that also diffused where the number of cases in HIV, and most of our troops who were in Liberia at that time came back relatively positive. And apart from also that, the hemorrhagic injuries resulting from HIV, the necessity giving of blood, were some of the things that also propagated the prevalence of HIV. Then more importantly, there was a weak HIV awareness and sanitation, especially from the Armed Forces Program and AIDS Control, that was established in 1993. So what was the reason for the NMOD USDOD program? One, there was concern by the Commander-in-Chief of the Armed Forces then, President Olusegun Obasanjo, and the military leadership, that there is need for us to contain this thing early enough. And how do we do that? We also need some funding. And as of 2002, we've had global fund for tuberculosis, malaria, and of course, HIV. And also the PEPFAR fund came on board in 2003, while the federal government counterpart funding came later in 2005. So we needed to access this fund for us to be able to manage that. Then we should also not forget that at that point in time, this commander-in-chief was President Olusegun Obasanjo. During one of his visits to troops in Ibadan, he said, and I quote, that this thing that He said, and I quote, good. That this terrible thing we call HIV/AIDS, for which there is no cure, must not be allowed to take its upper hand in our country. We must not allow AIDS to ravage our armed forces. This was in August 2001. As a follow-up to that, the Minister of Defense, General T.Y. Danjuma, while addressing officers at National Defense College in 2002, also stated, and I quote, "As enlisted men and women of the armed forces, you should not only fight HIV/AIDS, but you should be at the vanguard of fighting the disease in the nation," unquote. One of the commanders, who happened to be the coordinator of Armed Forces and AIDS Control then, Colonel Egbewumi, stated this, and I quote, "Many of our soldiers who have returned from ECOMOG operations had been documented as being positive for HIV/AIDS. AIDS is responsible for the loss of experienced and skilled personnel, leaving those less experienced to take more responsibilities." This was in February 2002. Now, what was the impact of HIV/AIDS on the Nigerian military at that time? There was a loss of esprit de corps and morale especially by the infected personnel. There was also a threat to discipline and regimentation posed by military personnel who were already infected. I remember then, they kept saying, I was well before I went for ECOMOG operation. Now I am back with HIV. What do you have for me? There was a sustained agitation by those who were infected and were seeking care and treatment. So the military commanders at that time had no option, because of the sustained agitation, to now turn the infected soldiers to treatment centers, including the controversially untested ones. If you remember the days of Abalaka, the Nigerian army in particular was put in such a very strong strain that the chief of army staff then, General Malu, now said, okay, since you have 5 divisions, let us send 4 soldiers, making a total of 20 to this person. Since, as at that time, HIV/AIDS had been seen as a death sentence, let us see whether these people can actually be cured. Of the 20 soldiers that went, only 1 person survived it. And that person refused to take that so-called vaccine at that time. So 19 of them had gone. We are not saying that it is the vaccine that caused it, but the fact is that even if they gave them, it really did not work for them. So apart from that, it was at that time that we had a Minister of State for Defense, in person of Sir Dr. Roland Orishijafor, who, in collaboration with the U.S. Secretary of Defense, Donald Rumsfeld, came up with the Nigerian Ministry of Defense and U.S. Secretary of Defense HIV program in 2005. It was then called Emergency Plan Implementation Committee. And what was the mandate? The mandate was to provide care, treatment, and support services to soldiers, their families, and civilians living within and around the barracks, and to also complement prevention services as rendered by the Armed Forces Program and AIDS Control. Then secondly, to engage in clinical research. The EPIC was funded by PEPFAR then, that's President's Emergency Plan for AIDS Relief, with counterpart funding from the federal government in 2005. Program implementation started in 4 pioneer comprehensive sites, but later the program now has 31 sites, as shown in the map. But I want to draw our attention to the fact that over 80% of the clients accessing HIV treatment, care, and support are civilians, thus demonstrating the program's contribution to the national HIV response. What is the organogram of the Nigerian Ministry of Defense, Walter Reed Army Institute of Research? We had at topmost the steering committee, whose function was to provide strategic guidance and direction. They also had the Ministry of Defense Health Run Program with Walter Reed Army Institute of Research, Africa, to coordinate the program, provide technical support, and coordinate clinical research, while the sites implemented the program as directed by the Technical Working Group. In short, this is how the organogram looks like. Then we also had the steering committee. The steering committee had 2 members, one from the Federal Ministry of Health. Apart from the 2 chairmen and co-chair, we had 2 members who were from Federal Ministry of Health and National Agency for Control of AIDS. The 2 of them made it look like the program is an integrated one that had some elements of national response, and that really helped in ensuring that the program was able to stretch beyond the armed forces to the civil population. So what is the program's, what are the program's activities and achievement? The first I want to mention is the site commanders meeting. You all know, you agree with me that communication is key when it comes to issues. You have your 31 sites out there. If you don't communicate with them, there are problems. So the commanders used to meet every 6 months to discuss the program leadership, direction, and to address issues that enhance program coordination at the sites. You can see the pictures of some of our past commanders, the directors of medical services, during one of the site commanders meeting, and of course the group photograph that is shown below. One other program that we're involved in is the Technical Working Group Committee. The Technical Working Group meets to address emerging issues and provide technical direction for the program. And the groups included Clinical Technical Working Group, Laboratory Technical Working Group, Prevention Technical Working Group, Orphan and Vulnerable Children Technical Working Group, and Clinical Research. All these groups also meet every 6 months to also decide and take decisions regarding what should be done at the program site. Another thing that's of very importance to us is the orphan and vulnerable children. This was a program that was launched by one of the past U.S. ambassadors in Nigeria, and it was aimed at providing tuition fees and books for orphans in primary and secondary schools, and vocational training for adolescents and out-of-school children. This program has continued, and I'm made to understand that it has become very robust now with the present DG Minister of Defense Health Program. It has gone beyond giving tuition fees now to the point that out-of-school children are also provided vocational training through the Defense and Police Officer-wise training center there. We're also involved in community engagement. You know that no matter what you do, if you are not engaging the community and also engaged in Barracks Health Committee, it might not work so much. So you can see Colonel Nelson Michael, who was shown earlier, addressing people living with HIV/AIDS in Makurdi, who were doing their normal monthly support group meeting. You can also see the former Chief of Army Staff's wife, General Ihejirika, who was part of the Nigerian World AIDS Day program in 2013. Then you can also look down, you see the picture of the Deputy Governor of Benue State then, who was part of the World's TB Day in Makurdi. All this showed a kind of community engagement as well as activation of the Barracks Health Committee and, of course, its strength. Now, let's come to capacity building. Within the last 9 years, about 10,908 healthcare providers were trained in thematic areas like clinical, laboratory, prevention, strategic information, logistics, and research. Looking at the bar chart beside it, you can see how it is disaggregated based on the number of years of personnel that were trained. So you can see how capital intensive it could be, and of course, we should also not forget the biblical saying that my people die for lack of knowledge. If you don't build the capacity of people, they are not likely to be very productive. The program has been doing so much of that within the period that its inception. Then apart from that too, the capacity building just is focused on thematic areas like adherence training, the pharmaceutical care training, the prevention of moral child transmission training, pediatric ART training, and other trainings like nurse refill training. Strategic plan had to come up in 2013, 2017 to look at what we have been doing. Then thereafter, the SBS plan now from 2019, I guess, to 2025, which is also looking at how we are progressing. I must say something about malaria microscopy later. Please, just allow me to say, good. So looking at this slide, the program went beyond looking at only the soldiers and their families. It now involved multi-state training. Within the period of about 6 years, the program was able to train laboratory scientists on malaria microscopy in 13 states, and a total of 313 lab scientists or technicians were trained on malaria microscopy. I'm sure you all know the importance of malaria in our, though it is endemic, but we know the extent of it on morbidity, mortality, and socioeconomic concern. Then we also had, in 2016, there was an outbreak of polio in a place in the Northeast, and it was a very hard-to-reach area. As a result of that, the military was asked to provide how they could contain that. So it now became a situation where, as troops are advancing, they're also having vaccine carriers. So that anywhere they go to, they see children, they will immunize them with polio. At that point in time, the program now saw the need for them to train frontline members on how to contain epidemic. So based on that, in 2018, about 56 personnel from the armed forces and the paramilitary had a training on disease outbreak investigation and management, which was handled by the Ministry of Defense Health Development Program in collaboration with Walter Reed and Ministry of Research. This was during the opening session of the program, where we had the then Permanent Secretary, Minister of Defense, who came to declare it open, and of course, a member from the Nigerian Center for Disease Control, who was also part of it. This is just a picture showing the training itself as at the time it was being conducted. Now, one other good thing again about this program is that all the program sites have migrated from the manual to electronic medical record system. All the 31 sites right now. As at 2015, it was only 44 Nigerian references to Kaduna that was on EMR. The Defense Headquarters Medical Center was on partial EMR at that time. But I must tell you that as of today, all the 31 sites are already on the electronic medical records. Now let's look at research activities. The program has been engaged in so many research. I just decided to pick a few of them. I'll just mention them. That the RV230 was the first that was conducted, then RV288, then RV329 is the one we call Africa Study. That's African Cohort Study, a 15-year program that started almost 9 years ago, a multi-country research that is ongoing and has centers in Nigeria, Kenya, Uganda, and Tanzania. They also had a PMTC linkage study, which also we have completed. Then we had this RV466. At the end of when the Ebola issue happened in Nigeria, there were so many issues that came up that there was the need for us to find out what were the possible causes of febrile illness in country. Since the program was already having robust laboratory capability, the need now arose for us to conduct this RV466, which is aimed at trying to understand the etiology of febrile illness in West Africa. And 3 countries were picked: Nigeria, Ghana, and Liberia. And out of the 3 countries, for Nigeria, we had 5 health facilities, 3 in the military and 2 in the civil setting, as shown. From Liberia, we had 1, and we also had Nogochi in Accra, Ghana, making a total of 7 health facilities that were engaged in the RV466. Interestingly, we also had the Ebola vaccine research. I must say it here, that as at that time, Nigeria was the first to conduct Ebola vaccine study. And it was Ministry of Defense, Walter Reed Ministry of Research, that initiated that Ebola vaccine study. Why? For the second one that I've shown, the RV456, 2 sites in Nigeria were picked for the test: Jos Teaching Hospital and MOD HIP. But they could not meet up because of other reasons, probably logistics. So the MOD HIP had to take up the number. So we're able to have about 330 participants from Nigeria. Then the Pastors Institute in Senegal was able to get part of the remaining people, and at the end of the day, the research held. It was a multi-country research too, which the result is out. And I must tell you here also that it was a fallout of this second research, RV456, that now led to another vaccine research that by Merck Pharmaceuticals, and the vaccine is being used in DRC as at today. They started using it this month because of the outbreak. So you could see that the evolution as a result of our initiation of the vaccine in country has helped. So I give kudos to Minister of Defense and Walter Reed program for this. Of course, we have to go back home. There was this military applicant study. We said, no, let us also look inward. So some of the applicants, people that are coming into the army, were now recruited to see whether, initially it was meant to look at the seroprevalence of hepatitis B among our applicants. But having done that, it's now gone beyond that, okay, those who don't even have the hepatitis B, can we see other things that we can check in them? We now decided to go for the reference values, the hematological and the biochemical analytes of the normal reference of individuals in Nigeria. We were able to complete that study, and it has been published in the PLOS ONE journal, which is also to our credit. Laboratory capacity development, very important. As of 2013, Walter Reed Research had provided the following equipment you are seeing. But MOD HIP had to complement that with what? We build the capacity of biomedical engineers so that all those equipment that were in other various sites, there was routine visit to those places and ensure that all those equipment were serviceable. So while our partners provided all this equipment, we also had to ensure that the thing remained serviceable for us to be able to use it. That shows the level of partnership, entrenched partnership within the program. The Defense Reference Lab is our flagship laboratory. A lot has been said about it. I'll just show you some of the equipment that are available within the Defense Reference Lab. The multi-head microscope for malaria microscopy, I had never seen it anywhere, but I saw it for the first time at Defense Reference Lab, where the trainees had to be on their own various positions, be watching, and the trainer will be there, and it's also projected for them to see. It's 1 in a million as far as this equipment is concerned. Apart from that, we also had other equipment that were used for serological analysis. Then we had the Cobas 8800, which is also used for viral load testing. All this, I must say, are equipment that are very, very expensive and were provided by our partners. Apart from this, we now also have a repository. This repository can store samples up to minus 196 degrees centigrade using liquid nitrogen. And of course, I have not seen it anywhere, though we may have it in 68, but this is one equipment that we have in country that has been helping the program. Apart from that, we now have the 661 Nigerian Air Force Hospital, which is our designated center of excellence for laboratory training. Then, of course, the 68 Nigerian Army Reference Hospital that also had the capability to diagnose Ebola, Lassa fever, yellow fever, and so on. These are part of the equipment that we have in the 68 Nigerian Army Reference Hospital. In summary, I must mention that so far, we have 5 laboratories in the military that are of 5-star status. Then apart from that, the Defense Reference Lab is also an A2LA accredited, that's American Association of Laboratory Accreditation in the country. The only one in West African sub-region. To complement whatever was happening, we ensured that they had alternative sources of power supply in all the 31 sites. This is also very important for us. Then now let's look at the MODE participation in regional health response. Please, I'm not scaring anybody, but when you look at what we are seeing there, it is a cemetery in Morovia called Disco Hill Cemetery. And all those who have been buried there were victims of Ebola. Morovia has a population, as at that time, of 4.5 million, and there were 3,084 graves here, apart from those that were cremated in the early part of the program. And surprisingly, if you look at the one that is up there, down, it's a generation of children aged 0 to 10 years, numbering 701 that also died of HIV. Because of generational loss, the US government came in to help in terms of logistics, but it was realized that it was difficult to get to the hard-to-reach areas within. For example, the Liberian Armed Forces had only 1 doctor at that time. It also had 2 nurses and also had 3 lab scientists and lab technicians. So it is difficult for them to manage Ebola at that time. And that was what really caused a lot of issues. It was then that what they call the Joint Water Research Group came up, initiated by Walter Reed Minister of Research, that how do we help our colleagues. After this thing, a lot of training came up. This was some of the training that were conducted for them. Also, to see that at least we have some degree of capacity building within. So what was the program's input in regional health response? 1, it strengthened the mechanism for rapid response to public health emergencies. 2, It built the capacity of healthcare providers in West Africa on epidemic prevention, detection, and response. It also strengthened the laboratory capabilities in terms of equipping and manpower. We also conducted the febrile illness, which I call the RV466. Then, of course, the Ebola vaccine study. All these are very robust studies that without sufficient funding, nobody could have been to carry it out. But with the support from the Walter Reed program and also the Nigerian Ministry of Defense, through the Minister of Defense, we're able to conduct all this research as appropriate. Then, to go beyond the region, bearing in mind that infectious diseases do not respect borders. And you also don't need visa. It does not need visa to cross into your country. So at that point we said we should link up with the Africa Partner Outbreak Response Alliance to be able to work together. When it was formed in 2015, there were only 12 countries involved. As of now, we have 34 countries that are also part of the African Partner Outbreak Response Alliance. This was a training that was conducted for the 6th African Partnership Response Alliance in Monrovia in November 2018, which we had then only 25 member states. So let me conclude. Please permit me to conclude by saying that the Minister of Defense Walter Reed program has contributed a lot to mitigation of HIV/AIDS in the armed forces and the nation. That was our initial mandate. It has also made a great impact on the healthcare delivery, thus enhancing troops' combat readiness. The partnership focused on human capacity development, well-equipped laboratories, infrastructural upgrade, has contributed to the nation's disease surveillance and real-time public health response. The sustained research efforts and the establishment of Nigerian Military Medical Research Training Program, NIMRET for short, is quite commendable. The program is capable of self-sustenance with adequate funding, especially from the federal government of Nigeria, bearing in mind that the funding from the U.S. Department is dwindling. We need to start thinking of how to improve the funding from our own side so as to guarantee sustainability. Then this is my plea and a prayer. There is a need for Nigerian Ministry of Defense Walter Reed program to put a compendium on how it turned the tide of HIV scourge in the armed forces and the nation. What does that mean? There should be a book that generations yet unborn can read through and say that, yes, something was done by those who lived before us. It is not difficult to do. It is doable. And yes, we can. So, on this note, I want to thank every member of the NMOD, HIP, and Walter Reed program for being able to take us from where we were in 2005, where we were struggling, up to the point where we can now stand to say that we have been able to reduce the scourge of HIV to the level that is no longer of public health importance. So congratulations to all the members for reversing the impact of HIV/AIDS scourge in the Nigerian armed forces. Thank you very much. Thank you very much for this.
I'll smile, don't know what it takes to fool this town. I'll do it till the sun goes down and all through the night time. Oh, yeah.
I see some people giving a standing ovation to our keynote speaker. I mean, that was a very simple presentation. Please, members of the program, staff of the program, please let's give him a standing ovation. I think he deserves that. No better person than someone who has worked under this program to present this and to give this information. Thank you very much. Thank you very much, our keynote speaker. We appreciate you. Thank you so much. Thank you. Thank you. right, thank you very much. Thank you, ladies and gentlemen. I mean, we listened to the presentation by our keynote speaker. We saw the numbers, we saw the statistics, and we saw the very great impact and the work that has been done throughout this 20 years of the existence of this program, this partnership between the US and the Nigerian military. Such impressive numbers and such impressive statistics. But something that's even more important is the fact that beyond the numbers, beyond the statistics, there are people that have been impacted, whose lives have transformed as a result of this program. So we're going to listen to some of these persons speak, and we're going to hear from them firsthand the impact of this program through these years. We're going to have representatives, partners, staff, and direct beneficiaries of the program. Distinguished ladies and gentlemen, and to start this session of testimonials coming from these three sets of people, I'll be starting with the partners. And today I have this very huge privilege and the honor to bring on stage the Vice President, Global Infectious Diseases, Henry M. Jackson Foundation, Dr. Sandia Vasa. HGF, make some noise for your own now. Please put your hands together for Dr. Sandia as she comes forward. Keep clapping, keep clapping, keep clapping. Keep clapping as she comes forward. Our very own Vice President all the way from HGF. Thank you so much for coming to Nigeria. Thank you.
Thank you for that warm welcome. Honorable Minister of State, U.S. Ambassador to Nigeria, and standing on all existing protocols, I'm both honored and humbled to speak with you all today on behalf of retired Major General Joseph Carvalho, who is both the HJF President and CEO and the President of HJF Medical Research International. But because I think that the real testimonials should come from those who have been the direct beneficiaries of this important work, and because the hour is late and I'm excited about a delicious Nigerian lunch, I will keep my remarks very brief. So HJF is a nonprofit organization that's authorized by the United States Congress, whose full name is the Henry M. Jackson Foundation for the Advancement of Military Medicine. And I can think of no better exemplar of this mission to support and conduct military medical research than the partnership between MODHIP and RARE here in Nigeria, which has been so well characterized by our keynote speaker. As he said, this began with a partnership for HIV prevention and service delivery through PEPFAR and HIV research with the Walter Reed U.S. Military HIV Research Program. But in the second decade of this partnership, it's really expanded, as he also detailed, not only to other viruses such as Ebola, but including Lassa, SARS-CoV-2, and dengue. And most recently, we've expanded beyond viruses into bacteria through our ongoing antimicrobial resistance surveillance program. And through these many learnings and accomplishments that have been detailed today, and many, many more that we don't even have time to discuss, this has directly benefited the Nigerian military and their families, and in so doing, protected the health and safety of U.S. warfighters. And along this journey, we've strengthened capacity, we've developed real mutual respect, and forged many genuine local and international friendships, and developed true trust. Because like a good marriage, those are the real foundations to establishing and maintaining a lasting partnership. As described in detail by Major General Lodi, we do look forward to continuing these engagements and expanding them in their scope, perhaps even beyond infectious diseases, to strengthen global health security. And so while we're here today to celebrate the past 2 decades of accomplishments, I say we're just getting started. Thank you.
Thank you very much. Please, can we give her another one round of applause? Thank you. Vice President, Global Infectious Diseases, Henry M. Jackson Foundation for the Advancement of Military Medicine, Dr. Sandia Vasan. Thank you so much for that very powerful testimonial and your message to us. Thank you very much. Very distinguished guests, ladies and gentlemen, moving on very quickly, I'll be calling on the next partner that will come on stage for their testimonial. And the program, of course, has been working over these years with the health initiatives for safety and stability. Welcoming the Managing Director of HIFIRST, Mr. Tudon Weja. Please, distinguished guests, ladies and gentlemen, give him a round of applause as he makes his way to the podium. Please clap for him, keep clapping. Thank you very much. Thank you.
I have to redefine my own protocols, so I will start with the DG, MODEP, General I.B. Solobo, the Commanding General of the U.S. Army Medical Research and Development Command, Major General Paul Lodi, distinguished ladies and gentlemen, all protocols duly observed. My name is Fredun Weja, and I'm the Managing Director of Health Initiative for Safety and Stability in Africa, popularly known as HIFIRST. HIFIRST is an indigenous non-governmental organization domiciled in Abuja. 18 years ago, we were entrusted with a very important responsibility under the NMOD USDOD HIV program to engage and manage staff for the program. At that time, we began with just 3 professionals, I think 2 medical doctors and a pharmacist. Today, I'm proud to say that the program has grown tremendously, and over the years, we've engaged and managed 344 personnel. Currently, our staff strength stands at 101 highly skilled professionals. This includes 16 medical doctors, 18 medical laboratory scientists, 6 medical laboratory technicians, 30 program administrative specialists, 18 data and M&E officers, 6 program pharmacists, 2 counselors, 1 admin, and 1 IT professional. These are not just numbers, they represent men and women who, through the program, have gained advanced training and capacity that they bring to bear in the service of Nigeria. Their work has gone far beyond HIV, AIDS. They played vital roles in mitigating the impact of COVID-19, Ebola, malaria, and other infectious diseases across the country. The impact is not only medical, it is also economic and social. Our staff have benefited from employment opportunities, world-class training, and access to healthcare services delivered across the country. These benefits ripple outwards, reaching families, communities, and the nation at large. And so on behalf of HIFIRST and our staff, we wish to say a heartfelt thank you to the United States government for the consistent support and funding from the very beginning of this program, funding through the Department of Navy and lately through Eric Jackson Foundation for Military Medicine. We thank the Global Emerging Infectious Surveillance Directorate for funding ongoing surveillance efforts in Nigeria, and to the Nigerian Ministry of Defense Health Implementation Program. We are deeply appreciative of the safe space, infrastructure, and environment through which quality healthcare is reaching Nigerians, and for funding the African cohort studies. In closing, we remain committed to the program. We will continue to ensure that the requisite skills, dedication, and passion of our staff translate into healthier lives, stronger systems, and safer communities. Long live the program. Thank you very much.
Thank you once again, the Managing Director of the Health Initiatives for Safety and Stability in Africa, Mr. Tudon Weja. Thank you very much. Thank you. Can we give him another round of applause, please? Thank you. All right, so moving on from partners, we're going to speak. We're going to have someone else speak to us. And this time around, we'll be receiving testimonials from the staff, the people, the foot soldiers, the everyday people that have dedicated their lives to making sure that this program is a success and to make sure that we're here to celebrate this success today. Distinguished guests, ladies and gentlemen, bringing on stage next, the director of the Defense Reference Laboratory, Lieutenant Colonel I. Ochai. Please, can we give a round of applause? Keep clapping. DRL people, are you here? DRL team, are you in the house? Make some noise. Make some noise. Thank you very much. Thank you.
The special guest of honor, the Honorable Minister of State for Defense, all special guests, please kindly permit me to adopt the protocol already established for want of time. Good morning, ladies and gentlemen. I'm Lieutenant Colonel I. Ochai, the Director of Defense Reference Laboratory. It is an honor and a great privilege to stand this afternoon to give a brief testimony of the achievements of the program over the past 20 years in this anniversary celebration. DRL is a product of the partnership between Ministry of Defense Health Implementation Program and the Watarik Army Institute of Research, Africa, Nigeria. The laboratory was established to provide the highest quality of diagnostics and research services in West African sub-region. Beyond this research and laboratory diagnosis, the laboratory have a mandate to provide training, mentorship, respond to national emergencies when called upon. And like I said, what I'm going to give is just a brief, because the keynote speaker has actually said much about Defense Reference Lab. Is my boss, and we've also seen a lot of pictures of the equipment and the structure. But it's good to note that the laboratory actually started just as a single room with just a container for staff and training hall, and which metamorphosed into what we have today as the Defense Reference Laboratory. In response to this mandate, the laboratory went through a series of quality management systems and was eventually accredited in 2018 for ISO 15189 2012 edition. This accreditation was sustained for 5 consecutive times. Recently, last year, to be precise, the lab was reaccredited again for the newest standard, which is 2022 standard, and DRL happened to be one of those laboratories in West Africa that has an accreditation. And it's also suffice to note also that the accreditation we have was done by the American Association of Laboratory Accreditation, who happen to be the highest accrediting body in the world. In the area of research, the laboratory participated in 14 different research, both national and international. This research ranges from surveillance to vaccines and clinical trial, just like has been highlighted in the speaker's note. And of course, they have actually contributed significantly to the health outcome in this country and also internationally. Furthermore, DRL is one of the 3 mega labs in Nigeria that handles HIV viral load. These tasks will have greatly contributed to the national in case detection treatment, and viral load separation, hitting the 95 global target that was set. Considering Nigeria as one of the countries with the highest burden of tuberculosis, the RARE donated the TB modular lab to the Nigerian government through Ministry of Defense Implementation Program, which was commissioned last year, about this time, by the Honorable Minister of State for Defense. This noble project received the highest safety certification and was activated by the national program to provide diagnosis, TB culture, drug susceptibility testing, among others. It's also of note that the capacity of this laboratory has also been increased to also carry out molecular diagnosis through the provision of TrueNAT and gene expert technologies by the national program. And also to add that the national program has also enlisted the TB modular lab for external quality assurance panel, and also a holistic assessment was also equally carried out in the TB modular lab to enlist, considering it for one of the reference laboratories to be considered for the national surveillance study to be carried out to be carried out next year, probably by first quarter of next year. In line with the mandate of Defense Reference Laboratory, the capacity was developed to provide services and support to other sister services and also across the military facilities. This we have achieved through the sustenance and maintenance of our biorepository in the production of liquid nitrogen, which we also assisted other agencies and also our other military facilities that is in need of it, and also our aid in the shipments of biological samples internationally. Additionally, we also have capacity for equipment calibration, which was also achieved via this partnership. Through this collaboration and through the capacity of the equipment calibration lab, we have assisted other platforms, we have assisted other facilities preparing for accreditation. Not only for accreditation, we also help to maintain the equipment and to ensure that the equipments are in service and continue to maintain them in service for service delivery. Some of those capacities that were developed were come across training, mentorship, and as well respond to national emergency. All these were evident during the COVID-19 pandemic, where the Defense Reference Laboratory actually responded actively when we were called upon, and we supported the national and contributed well over 30,000 tests conducted in Defense Reference Laboratory. Finally, permit me, sir, to say that I was also a beneficiary of this collaboration. I benefited enormously from the training mentorship of the program, and I suppose to say that I will always give my best in any capacity I have to serve this country through this program as I'm deployed. Thank you, sir.
Would like to appreciate one more time thank you. Let's give him another round of applause. Thank you very much. Thank you. Thank you. Lieutenant Colonel I. Ochai, Director, Defense Reference Lab. Thank you very much for that. And just while the DRL director was on stage, I spotted someone in the audience, someone I respect very much in the media space in Nigeria, Mr. Adebola Williams. Please, can we give him a round of applause? He's somewhere in the audience. I'm not sure if he just sneaked in, but your red cap gave you up already. Thank you so much. Welcome, welcome. All right. Now, distinguished guests, ladies and gentlemen, we're talking about the heart, the soul of the program, the direct people that have also benefited from this, and we're going to have a testimonial from one of the beneficiaries, one of the mentor mothers, and a beneficiary of the program, Mrs. Kelechi Adeyemo. Please, if you're here, kindly step forward for your testimonial. She's coming forward. Please clap for her. She comes forward. Thank you.
Wow. Yeah. Shut it. This one goes out to all my women, you know, my strong women. So I may.
Good day, ladies and gentlemen. Please permit me to continue on the already established protocol. My name is Kelechi Adeyemo, mentor mother to the Military Hospital, Ibadan, and I also double as the governor of the Mentor Mothers Forum under the NMOD HIP and Rare Africa Nigerian program. I am here to share my story as a beneficiary and also as a mentor mother. I was a pregnant woman in 2014 who went to the Military Hospital Ibadan to register for ANC. And I was informed that I tested positive to HIV. I was scared, I was afraid, I was also worried for my unborn child. But after counseling, I was placed on ART immediately. I had my child, and after the 18 months final outcome, she came out negative. And in 2016, an opportunity came up for the training of mentor mothers here in Abuja. And I was among those who were trained. After the training, I went back to Ibadan with the help of my site team leader, Dr. Olakpade, and my site administrator, Ms. Ugochi Amazwe. We started the Mentor Mother Support Group program immediately, where we had women who were positive and pregnant and also breastfeeding. We brought them together, and I was able to share my story with them. Some of them too were first-time mothers who were afraid for their babies. But after sharing my story, they were encouraged, and I make bold to say that we have had babies under this program who all tested negative at the end of the 18 months period. The support group comprised of women within the barrack and outside the barrack. We have learned to come together to share our stories, share our experiences, and also encourage ourselves. And these women also want to believe that if Kelechi can do it, they too can do it. So I want to sincerely appreciate the Nigerian government and the US government for this opportunity, and also appeal that this program be sustained so that more women will also benefit. Thank you.
Thank you very much. Thank you so much, Mrs. Kelechi Adeyemo. That was very beautiful. Thank you so much. Thank you. At this point, I'd like to bring on stage another beneficiary of the 20-year partnership. I will be inviting on stage right now Master Warrant Officer Musa Emmanuel, retired, to kindly come forward for his testimony. Please, can we give a round of applause as he comes forward? Thank you.
I am Master Warrant Officer Musa Emmanuel, retired. I beg to stand on the existing protocol. In 1996, I tested positive to HIV. Now, the impact came to me in 2001. That was when I had malaria. In one of our military installations, they tested me without telling me. And actually, Nobody told me. I was left in my ward. My commander, being a good man, came to check on me. And a nurse told him, allow this soldier to die. We are waiting for him to die. I want to appreciate the USDOD, specifically the year they came to Nigeria, or rather the year I came in contact with them in 2005, was the year that a colleague sent a message to our pay point that I am dead. So my salary was stopped for 6 months. However, with the coming of the USDOD, I want to thank my mother specifically. Is Doshima here, please? Let's just see her face. So Doshima, the day I met her, my commander then in the hospital called me and introduced me to them. I think that's the beginning of myself saying I'm alive. Well, before I left the hospital, the barracks was already, the news was already hot in the barracks. My wife was selling small kiosk provision in front of the house. Not a single person came to buy again. The children in the barracks, nobody agreed to cross my room, even though I was in the middle of the block in Abacha barracks. My children were sent out of secondary school, the command secondary school. Primary school. And my last born was driven away from school. Those are other stories. When I entered the church on Sunday, the whole pew was left for me. On Monday morning, after being discharged, I wanted to go to the office. They sent immediately from the office that they know I'm not well, I shouldn't worry. Work, I should just stay at home. All my RC will be coming. Well, I want to thank God. The day I came in contact with the USDOD, I had a counselor, I had a mentor, I had a lot. In fact, the awareness, I would say it's lack of awareness that time. And by the time I became aware, everything changed. We formed a Defense Health Club with support from USDOD. We were able to use the Defense Health Club to do a training on peer education by USDOD, MOD, USDOD. The Defense Health Club, after selecting some specific soldiers trained as peer educators, were able to go around all the barracks in Abuja to do what we call awareness then. We will call the Magajia and the RSM and say, okay, organize a team. People living with HIV will come and show their face and we'll talk. That's how we raise the awareness within the barracks. With the support of the USDOD, we were able to bring other people on treatment. I remember clearly my salary being stopped. I used the RC I was collecting every month to go to Benue. And by the first week, second week, I think we were bringing more than 4 911 vehicles, those 911 buses that time. We come and sleep in the parade ground. In the morning, doctors will work sometimes till midnight. I specifically want to say thank you to General T.O. Omar. I remember that time, at that very time, many vehicles refused to carry you when they know you're HIV positive, more especially when you're already down and out. When you have AIDS, you know how it looks. No vehicle agreed to carry you. So I was using my personal golf to move from one community to the other, to move them to hospital. One day, the vehicle, after overuse, no service and the rest of them, caught fire and the whole thing finished. When I ran back to the program, the MOD, then it was epic. I met General Omar. I said, Daddy, this is the problem. He immediately made arrangements for us to look for a vehicle. So I want to specifically appreciate the program because I can say this program came to Nigeria for me because I started with the first block, and as of today, I'm retired. I'm still part of enjoying the program, and I'm sure that a lot of things are working. Thank you very much.
Ladies and gentlemen, that's a perfect place to clap. I want you to put your hands together for every single representative on this stage today, every group from the partners, the stakeholders, the staff, the beneficiaries, every single person that has testified to the success and the impact of this 20-year partnership. Thank you so much. That's not a good place to clap. Put your hands together, ladies and gentlemen. We're clapping for everybody together. For 20 years, for year 1, for year 2, for year 3, 4, 5, 6, 7, make it louder, 8, 9, 10. For 15, ladies and gentlemen, for 20 years of impact, put your hands together. Now that sounds more like it. Thank you very much. I'm trying to warm you up because I'm about to bring the Ajanla on stage right now, the madam at the top when it comes to the program, the Walter Reed Army Institute of Research, Africa, Nigeria. One woman who's been at the front, making sure that all the successes that we're recording, everything is happening and going smoothly, managing the program. Distinguished ladies and gentlemen, I'm talking about none other but a global public health expert, the country director of the Walter Reed Army Institute of Research, Africa, Nigeria. Helena Mary, ladies and gentlemen, please keep clapping. Members of staff, you want to put your hands together. Oh, are you seeing that? Hey, ladies and gentlemen, give it up, give it up. Hey, 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 hey. Are you seeing that? All right. Ladies and gentlemen, thank you. She's one of us.
Good afternoon. Thank you. Thank you. Good afternoon, everyone. It is my profound honor to be standing here to give a vote of thanks as we adjourn from today's celebratory event. I have nothing more to add and say. Everything that can and should be said about our partnership has already been said and covered thoroughly by all the speakers who grace the stage today. So I just want to say thank you. I'd like to end how we started by saying thank you to everyone who's made this 20-year journey possible. So if I can ask, do we have any site commanders in the room? If you are a site commander, can I see a show of hands and hail you and salute you? Well done, site commanders. If you're a site team leader for any site supported by this program, if you're a site team leader, can I see you wave your hand? I see you. Well done, site team leaders. Site administrators. Site administrators. I see a few hands in the back. Well done, representing for all the sites that we support across this federation. If you are a member of the data team, any way, anyhow, if you collect data, if you analyze data, if you're helping store data, if you're helping secure data, if you're helping electrify data, please show of hands. We thank you and your efforts. If you are working in the lab, if you're on the bench, near the bench, around the bench, if you help repair equipment, if you're a biomedical engineer, if you are running assays, if you are a medical lab scientist or a medical lab technician, can I see a show of hands? This work is not possible without you. If you are a clinician, any sort of provider, if you're a doctor, if you're a nurse, if you are a pharmacist, I see a few hands. There have to be more now. Raise your hands high. There you go. We thank you. We salute you. If you are a member of our science and research team, helping us to understand better and characterize better what we see unfolding in the environment, can I see a show of hands? Okay, science and research team, we see you. If you are doing a lot of the sometimes unseen, less glorious work, but the work that we stand on to get anything done, if you're in operations, if you're in procurement, if you're in finance, if you're in staffing and personnel management, if you are doing a lot of times the invisible work that helps us get actually the mission achieved, can I see a show of hands? Where are you? Where are you? We see you. And we thank you. We salute your service. So I think the tagline for this event, 2 nations, 1 mission, and 20 years of impact, says the whole story. So I'll just end by saying 20 years, guys. 20 years no be beans. Huh? Chai. 20 years done waka. Una still dey campe. Eh?
Not be juju be that.
Not so partnership supposed to be. Full ground. No shaking. So really, all I have to say is make you enjoy the celebration today and tonight to the fullest. You deserve them. Congrats, Jare. Here's the 20 more.
A good woman no come from the Lord. They know they see her for market. A good woman is a blessing.
Ladies and gentlemen, please put your hands together as the country director of the Walter Reed Institute of Research, Africa, Nigeria, Helena Mary takes us. So thank you very much. Put your hands together for yourselves. Everybody in the house, this is a good place to clap for yourselves. Thank you. We're approaching the end of the event already. Just a few announcements before we go. All right. So we're just going to do something very quickly.
For market. I tell you more, Yaku. One year batra kolisa seva. Yano more, Yaku. One year batra kolisa. Always loving everybody, no discrimination. What I did, no competition.
All right, thank you very much, everybody. Just a few announcements before we close. So, I know all of you are hungry. Apologies, first of all, we started late and we couldn't buy the time. But I want to believe that you all enjoy the talk. Yeah, so please give, yes. So we're going to have lunch now. We're going to eat in 2 sections. So if you are sitting, that's why I say you are upgraded to business class. For those of you that refuse to enter the business class, you're on your own. So if you are sitting on the white seats, you pass through this door, the front door. It's a VIP, so the boardroom by the left as you're going out, you see VIP room. That's where you're going to have your lunch. I don't want to say Yakubai, but the rest of us, we prepared a very beautiful environment, good scenery. It's called the Coconut Garden. So you are going to the Coconut Garden. Ushers will usher you out, and then they will lead you. And lastly, we're going to take a group photograph. So if you are from MOD HIP, and if you are wearing uniform, please you will assemble yourself where the 20th anniversary banner is. If you're wearing uniform, Nigerian military uniform. If you're a visiting delegation, you also join that crew. Yeah, before we close now, since we have the honor of having our VVIPs, I think the MC has some surprise for you. So, MC, over to you.
All right, thank you very much. I mean, that was a setup. No surprises, by the way. We just wanted some of our dignitaries in front to please come forward to the stage. Just one final session, and after that, we just all move out. Some of the dignitaries in front, and then some key members of staff, if you don't mind. We just want something very good on video that will appear with the lights and stuff. Just nothing else serious, that's all. Come on stage.
Come on for the body, no they breathe. Put on your shoe, make it stand that deep. All your sorrow, make it dance them free. If you know be kalala kalala, yeah. If you know be kalala, then put mama jogo, ijogo, ijogo, ah, what you want, my jojo, ijogo, my jogo, and if you know be kalala, then put Motupa, Oluwa, yeah. Joy is coming.
All right, thank you.
Joy.
All right, thank you. We'll take some pictures together, and after that, thank you. Ladies and gentlemen, we've come to the end of this event today. Thank you very much for being a part of it. But 20 years of impact, 20 years of success, 20 years of transforming life, 20 years of strengthening military healthcare in Nigeria. No easy feat at all. Are you ready to celebrate with us? I can't hear you. Are you ready to celebrate with us? No, you're not saying it like a minute. Are you ready to celebrate with us? DJ, are you ready? Are you ready? So we're taking some pictures right now, and after that, we're just going to let this fireworks go up, and then we'll just celebrate and go out. Are you ready? Ola, are you ready? Cool, thank you. DJ, are you ready? So ladies and gentlemen, we're just going to count down from 1 to 20, or count up however it is, from 1 to 20, and then we'll just let the fireworks go up. Are you ready? Are you ready? So we're starting from number 1. When you see my hands up like this, you just count. Are we ready? So ladies and gentlemen, 3, 2, 1, can I get the first number? And after 1, what's next? And after 1, what's next? And after 2, what's next? And after 3, what's next? And after 4, what's next? And after 5, ladies and gentlemen. And after 6, what's next? And after 7, what's next? And after 8, what's next? And after 9, what do we have? And after 10, ladies and gentlemen. And after 11, what do we have? And after 12, ladies and gentlemen. And after 13, do we step it up? And after 14, what do we have? Are you getting ready? After 15 years, we did not stop. We decided to move forward, changing lives, transforming life. What 15, what do we have? And after 16, ladies and gentlemen. And after 17, what do we have? 18, what do we have? And after 19, ladies and gentlemen, it's 20 years of impact. Make some noise! All right. Thank you very much, ladies and gentlemen. Thank you very much for being a part of this activity. Thank you so much for adding color to this event this afternoon. Thank you for 20 years of impact. Thank you for 20 years. And right now we've come to the end of this event. Hey, all right.
Celebrate good times, come on. Let's celebrate. There's a party going on right here. A celebration to last throughout the years. So bring your good times and your laughter too. We gon' celebrate your gonna party with you. Come on.
Thank you very much.
Let's all celebrate and have a good time. Celebration. We gon' celebrate and have a good time. It's time to come together. It's up to you. What's your pleasure? Everyone around the world, come on!
It's a celebration.
The VVIPs are stepping out first. The VVIPs are stepping out for lunch first. The VVIPs are using the first door. The VVIPs are stepping out through the first door and they are going out first. Thank you very much.
It's alright. We're gonna have a good time.
Alright, it's picture time.
It's alright, baby.
All right, thank you very much. I think it was fun. Was it? Was it fun? Was it fun? All right, it's time for a photograph. So if you're wearing uniform, as I said, please can you assemble yourself? If you're wearing uniform, all military officers, please can you gather outside? Military officers. Thank you very much. Of course, lunch staff, please go to Coconut Garden. If you want Orange Garden is there. If you want Mango Garden is there. Please. All right. All military officers, please let's gather outside. Yes.
So please don't forget that there's still a part 2 of this. There's a dinner tonight here, the same venue. Please don't forget to come back. At 5:30 p.m. we're gathered here for the dinner and the gala night. Please don't forget. That's the part where we're going to have fun and boogie down finally. So please don't forget to come back. Thank you.
Mount up. It was a clear black night, a clear white moon. Warren G was on the streets trying to consume some skirts for the E, so I could get some phones. Rolling in my ride, chilling all alone.
Just hit the east side of the LBC on a mission trying to find Mr. Warren G. Seen a car full of girls, ain't no need to tweak. All you search know what's up with 213.
So I hooked select on 21 and Lewis. Some brothers shooting dice, so I said, let's do this. I jumped off the ride and said, what's up? Some brothers pulled some gas, so I said, I'm stuck.
These girls pick me, I'm gonna glide and swerve. These hookers looking so hard, they straight hit the curve. Want to pick up better things than some horny tricks. I see my homie and some suckers all in his mix.
I'm breaking myself. I can't believe they taking Warren's wealth. They took my rings, they took my Rolex. I looked at the brother, said, damn, what's next?
They got my homie hemmed up and they all around. Can't come up see him if they going straight down for pound. They wanna come up real quick before they start to clown. I best pull out my strap and lay them busters down.
They got guns to my head, I think I'm going down. I can't believe it's happening in my own town. If I had wings, I would fly, let me contemplate. I glance in the cut and I see my homie Nate.
16 in the clip and 1 in the hole. Nate Dogg is about to make somebody's turn cold. Now they dropping and yelling, it's a tad bit late. Nate Dogg and Warren G had to regulate.
Cause girls is players too. Yeah, cause girls is players too. Keep it playing, baby. Cause girls is players too. Bitches getting money all around the world, cause girls is players too. What you know about living on the top? Penthouse suites, looking down on the ops. Took her for a test drive, left them on the lot. Time is money, so I spend it on a watch. Hold on, little titty showing through the white tee. You can see the thong busting on my tight jeans. Okay, rocks on my fingers like a nigga wife me. Got another shorty, she ain't nothing like me. Yeah, about to catch another fight. Yeah, the apple bottom make him wanna bite. Yeah, I just wanna have a good night. just wanna have a good night. Hold up, if you don't know, now you know. If you broke, then you gotta let it go. You could have anybody, any money, mo. Cause when you a boss, you could do what you want. Yeah, cause girls is players too. Yeah, cause girls is players too. Keep it playing, baby. Cause girls is players too. Bitches getting money all around the world, cause girls is players too. I go on and on and on again. He blowing on my phone, but I'm ignoring him. He thinking he the one, I got like 4 of him. Yeah, I'm sitting first class like valedictorian. Came a long way from rag to riches. 5-star bitch, yeah, I taste so delicious. Let him lick the plate, yeah, I make him do the dishes. Now he on news 12, cause a bitch we're missing. Sheesh, about to catch another fight. Yeah. The apple bottom make him wanna bite. Yeah. I just wanna have a good night. I just wanna have a good night. Hold up, if you don't know, now you know. If you broke, then you gotta let it go. You could have anybody, any money, mo. Cause when you a boss, you could do what you want. Yeah, cause girls is players too. It's time we let them know that girls is players too. Keep it playing, baby. Cause girls is